High blood pressure is one of the world's most widespread chronic conditions. But did you know that it doesn't affect men and women equally? In some countries, men are far more likely to suffer from hypertension. In others, it's women who carry the heavier burden. And in a few places, the numbers are almost identical. In this video, we reveal the top 10 countries in each of these three categories, based on official WHO data. Get ready to explore where the gender gap in hypertension is wide and where it disappears. In some countries, men are significantly more likely to suffer from hypertension than women. This gender gap can reach more than 15 percentage points. In this segment, we reveal the top 10 countries where male hypertension rates far exceed those of females. 10. Estonia. And rounding out the top 10 is Estonia, where 45.9% of men live with hypertension. For women, the rate is just 34.2%, an 11.7-point difference. Rapid modernization and stress-related health issues affect men more severely. 9. Lithuania. Lithuania comes in ninth. Hypertension affects 54% of men, while 42% of women are impacted. The 12-point gap is hard to ignore. High alcohol use and metabolic syndrome in men elevate cardiovascular risk. 8. Luxembourg. At number 8, Luxembourg stands out with 36.6% of men affected and 24.2% of women. That gap of over 12 points highlights lifestyle differences. A wealthy country with notable male lifestyle-associated health disparities. 7. Spain. Spain appears at number 7. 33.5% of men are hypertensive, compared to 20.8% of women, a difference of almost 13 percentage points. A Mediterranean country, but younger men face rising metabolic risks. 6. Poland. In sixth place is Poland, with a gap of nearly 13 points. 55.5% of men versus 42.7% of women. Traditional male dietary patterns and underdiagnosis may explain the gap. 5. Argentina. Argentina takes the fifth spot. Male prevalence is 54%, while for women it's 41.2%. That 12.8-point gap puts Argentina firmly in the top half of our list. Urban male populations face increasing pressure from diet and sedentary habits. 4. Denmark. Coming in fourth is Denmark, where 43.3% of men live with high blood pressure, versus just 28.6% of women. That's nearly a 15-point gap. Despite excellent healthcare, lifestyle choices may still affect male outcomes. 3. Hungary. In third place is Hungary. Here, 55.9% of men are affected, while the rate among women is 40.9%. The difference isn't subtle, it's a full 15 points. Eastern European diet and high rates of smoking contribute to cardiovascular risk. 2. Czechia. Czechia ranks second, where almost half of all men are hypertensive. That's 49.1% compared to just 34% of women, a stark contrast of over 15 points. A high prevalence country with strong dietary salt and alcohol consumption trends. 1. Japan. At the top of the list is Japan, showing the most dramatic gap between genders. More than 40% of men there live with hypertension, while just over 22% of women do, a difference of nearly 18 percentage points. Known for longevity, yet modern lifestyle stress may impact men disproportionately. In some parts of the world, women are not just equally affected by hypertension, they are more likely than men to suffer from it. While much of the global focus has been on male cardiovascular risk, these countries flip the script. Here are the top 10 countries where women face a significantly greater burden of high blood pressure than men. 10. Mozambique. Rounding out the top 10 is Mozambique, with women at 41.9% and men at 34.3%, a 7.6-point gap. Social roles and chronic stressors put women at greater long-term risk. 9. Mali. At number 9 is Mali. 38.3% of women are hypertensive, compared to 30.5% of men. Healthcare disparities and postnatal complications may be elevating risk for women. 8. Indonesia. 8th place goes to Indonesia, where female prevalence reaches 44.5%, compared to 35.9% for men. Diet and rising obesity rates have made hypertension increasingly common among women. 7. Zimbabwe. Zimbabwe comes in 7th with 46.4% of women affected, versus 36.9% of men. Ongoing economic hardship has had disproportionate effects on women's long-term health. 6. Solomon Islands. Solomon Islands lands in 6th place. Hypertension rates are 34.5% among women and just 24.9% among men. Nutrition and maternal health history may explain the gap in hypertension rates. 5. Eswatini. In 5th is Eswatini, where 47.3% of women are hypertensive, compared to 37.4% of men. A high prevalence of metabolic disease among women is a growing concern. 4. Afghanistan. Afghanistan ranks 4th with a similar disparity, 45.3% for women, 35.3% for men. Cultural barriers and poor access to services may leave women more vulnerable. 3. Haiti. Coming in 3rd is Haiti. Hypertension affects 47.8% of women, compared to 37.6% of men. That's a 10.2-point gender gap. Limited healthcare infrastructure affects women disproportionately in rural areas. 2. Bangladesh. Bangladesh takes 2nd place. 34.2% of women live with hypertension, while only 23.5% of men do, a 10.7-point difference. Gender inequality in healthcare access likely contributes to this stark difference. 1. Lesotho. At the very top is Lesotho, with the widest gap favoring women. Nearly 46.8% of women there have hypertension, compared to just 32.1% of men, a striking difference of nearly 14.7 percentage points. In Lesotho, women's health burdens are compounded by social and economic challenges. In most countries, hypertension affects men and women quite differently. But not everywhere. There are a few places where the gender gap in high blood pressure nearly disappears. Rates are nearly identical, no matter the sex. These countries may offer clues. Clues to how healthcare access, prevention, or lifestyle patterns can close the gap. Let's take a look at the top 10 countries where men and women face hypertension on nearly equal terms. 10. Yemen. And rounding out the top 10 is Yemen. Despite being a country with many healthcare challenges, men and women experience hypertension at nearly the same rate. That kind of equality in health statistics is notable, especially in regions facing systemic access issues. 9. Malaysia. Malaysia ranks 9th. Hypertension affects men and women at very similar levels here, making it a truly shared burden. This may reflect growing awareness and outreach efforts being applied without gender bias. 8. South Africa. In 8th place is South Africa. This nation shows a strong alignment between genders, with nearly parallel prevalence rates. It may point to national-level interventions that are inclusive and equitably reaching both men and women. 7. Cambodia. Cambodia holds the 7th spot. The rates of hypertension for men and women are separated by just 0.4 percentage points. Such a minimal gap suggests that public health dynamics may be evenly distributed across the population. 6. Colombia. 6th on the list is Colombia. Here, hypertension doesn't seem to discriminate, it affects men and women at nearly the same rate. This closeness hints at parity in both risk exposure and access to healthcare services. 5. Tunisia. Tunisia takes 5th place with nearly identical prevalence, 34.5% among men and 34.8% among women. Though a small difference exists, the numbers reflect an overall balance in how hypertension impacts both sexes. 4. Dominican Republic. In fourth place is the Dominican Republic, where just 0.2 percentage points separate male and female hypertension rates. This narrow margin may reflect shared lifestyle patterns or uniform access to treatment and prevention programs. 3. Thailand. Thailand ranks third. Here, the prevalence of hypertension is virtually equal, 29.2% for women and 29.1% for men. A gap so small it practically vanishes. Such parity suggests societal and healthcare systems are working equally for both genders. 2. Belize. Coming in second is Belize. Hypertension affects exactly 38% of men and women alike. This rare statistical symmetry may reflect environmental or behavioral factors that influence both sexes equally. 1. Saint Kitts and Nevis. At number 1 is Saint Kitts and Nevis, an extraordinary example of gender equality in cardiovascular health. According to the data, 45.1% of both men and women have hypertension, making the gender gap literally non-existent. This kind of balance is rare on a global scale and may point to equitable healthcare access and similar lifestyle habits across genders. Across the world, hypertension doesn't affect all people equally. In some countries, men are far more vulnerable. In others, women carry the heavier burden. And in a rare few, the numbers are almost perfectly balanced. What explains these differences? It could be biology. But it could also be diet, stress, healthcare access, or the roles we assign by gender. What's clear is that data like this doesn't just reveal health risks. It reveals opportunity. Opportunity to question long-held assumptions, to rethink public health strategy, and to close gaps where they don't belong. Thanks for watching.